I'm Eileen Doherty, Executive Director of the Colorado Gerontological Society, and I would like to welcome you to our new To Medicare presentation. Before we start, I would like to give you a little bit of information on how to navigate this platform. So over here on the left, you see a 1 with a big red rectangle. Ignore the blue wheel at the top because that is Hopin's logo. The reception area, which is highlighted, which is blue, which is where we are at this point in time. That is where we all start when we open Hopin. The second button is a camera, and that is the stage area. That is where I will be speaking from once we've finished the original navigation here, instructions. And then the third section is the expo, and that is where the exhibits will be, and that will light up as well. On the right, we have a 2 with a red rectangle, and it has the words chat as well as polls in it. And chat is where you can put information in, you can talk to us, you can ask questions. To talk to us and ask questions, you basically put them in the box that is labeled 3, and you can just type in there. When you finish typing, hit return, and it will post the information. You can also participate in the polls, which asks you basic information about where you live and whether or not you like the program. The second area where we said we would go to is the stage, and here is the blue camera, which is lit up. As you can see over here on the right, there's another chat box with polls. If you want to talk to us when we're on the stage, then you put that information down here in box number 3. As you can see here in the middle is my picture, and as soon as the presentation starts, that will switch to my picture in the corner as well as the PowerPoints. The last area where we will go is the expo, and this little tent thing has turned on, as you can see on the left-hand side under the 1. And then if you click on these rectangles, what happens basically is you enter the booth and you can talk to the people there. So if we move to the next slide, we can see that the tent is still on in the 1 box. We move over here to the 2 box. We see that the booth is now lighted. We can do the chat and the polls again. So we click on those. We can participate in them. In the 3 here, if you click on the little button, you can talk to the individual who is at the various booths, and they can talk and chat with you. If you want to take advantage of the information that's available in this demonstration, Cigna is offering a free water bottle. If you click down here on the Send Me More Info, then you can request one of those as well as talk to them. So with that, let's go ahead and get started with our Medicare Monday presentation on New to Medicare. The first thing that we want to talk about, obviously, is that if you are eligible for Medicare, you have to be age 65 and you have to have paid into 40 quarters of Medicare, or of Social Security, or a spouse has. The most important thing that we're going to talk about today is Medicare Parts versus plans. Medicare has parts A, B, C, D. We support Medicare Advantage, Medicare supplements, and prescription drugs with plans that Medicare doesn't cover. Medicare has 4 parts. Part A, which is hospital, skilled nursing, home health, and hospice. Part B, which is medical, which includes physician visits, labs, x-rays, ambulances, emergency rooms, vaccines, preventive services. Part C is a Medicare Advantage, and that is an HMO, a PPO, or a private fee-for-service. And Part D is prescription drugs. We want to spend most of our time today on Medicare enrollment periods, and that is when to sign up. So we have an initial enrollment period, or an IEP, which happens when you turn 65, or if you have been disabled for 24 months. We have an annual enrollment period, which happens from October 15th to December 7th. You will want to pay attention to the AEP every year because you will want to review your prescription drug plans and make any changes. If you are in a Medicare Advantage, or you want to look to join a Medicare Advantage, or you want to change Medicare Advantages, you will also need to do that during the AEP from October 15th through December 7th. We also have the general enrollment period, which happens usually only once in your lifetime if you miss your IEP or your special enrollment period. And if you have to use a GEP, you enroll for Medicare between January 1 and March 31, and benefits start July 1. If you have a special enrollment period, that usually means that for some reason or other, you did not exercise your right under your IEP. And this happens often with people who are employed, if they move, or if their situation changes. The question then is, do I have to apply for Medicare? And the answer is, it depends. So you will get Medicare automatically if you're receiving Social Security, if you're getting a Social Security check or railroad benefits, and you're age 65. If you are not getting Social Security, then you will have to apply for Medicare. So how do we determine credible coverage? This is probably one of the most important things, especially if we are deferring coverage or benefits to a special enrollment period. Credible coverage is known as the health insurance that you have, usually offered by an employer, must have the same benefits and coverages or better that Medicare currently offers to their beneficiary. Some credible coverage then companies are Tricare, which is for military veterans who have served 20 years, FEBA, which is Federal Employee Health Benefits, and employers, some offer credible coverage and some do not. Non-credible coverage is offered through COBRA. Oftentimes people will either retire at 65 or their employer will offer them coverage for their health insurance for 8 months via COBRA. And if that happens to you, you do not want to take it because you will lose your initial enrollment period, you will be faced with a special enrollment period, and you will most likely face penalties. Other non-credible coverage that we have is VA benefits. This is individuals who have served in the military for 2 or 3 or 4 years and get their care at the VA. So let's look at the Medicare initial enrollment period, which is the IEP, happens 3 months before you turn 65, the month you turn 65, or 3 months afterwards, which is a 7-month period. So we were going to now look at Medicare Part A and B, and this section is color-coded. As we go through this, I want you to put yourself in one of the colored boxes. If you are receiving Social Security, you're age 65, you're not employed, and either you don't have health insurance or your health insurance stops through the exchange or the individual program that you have on your 65th birthday, then you're in the dark blue box and you do nothing. Your Part B premiums will be deducted from your Social Security check, and coverage will start the first day of the month that you turn 65. If you're not receiving Social Security because you're still working, you want to have the benefit accrue longer, but you want to take Medicare, then you are going to have to enroll in Medicare. You're going to have to sign up at Social Security. You will have to send a quarterly check to cover your Part B premiums, but your coverage will start the first day of the month that you turn 65. If you or a spouse are employed and you have health insurance and your employer is going to be involved, then you will be in the yellow box. So we have to look at 3 different ways that the employer can be involved. They can pay all of the costs, and if so, will delay Part B and D and will apply for an SEP, or a special enrollment period. If your Medicare is going to pay, or if your company is going to pay either primary or secondary, then we are going to have to keep our Medicare Part B, because either the company will pay first and Medicare will pay second, or Medicare will pay first and the company will pay second. Similarly, we will have to look at whether or not the company has credible coverage for prescription drugs, and if so, we'll have to make that decision. If you are currently receiving Social Security at 65 and you have VA benefits, you will be in the bright blue box. You do not need to keep Medicare Part B. You will start receiving A at 65, but you should consider keeping it, because if you do nothing and decline B, then you can sign the form, sign the card, send it back to Social Security, and you'll only have Part A. Your A coverage will start the first day of the month in A. If you decline it, then you won't have any B. If you decline it and you want to sign up for B in the future, you will face a penalty of 10% per year for every year that you did not enroll. If you're not receiving Social Security, you have VA benefits, and you are still employed, you will be in the red box. You'll again start receiving your A at 65. Check with your employer to see if they're going to pay full or primary benefits, then refer back to the yellow box to determine how your employer will be involved. If you are receiving Social Security and you have Tricare, then you will be in the purple box. You will again start receiving A at 65. You do have to keep and enroll in Part B, because Tricare functions as a Medicare supplement or secondary to Medicare. If you have Tricare, usually you do not have to enroll in D unless you want to, because Tricare has a very generous prescription drug benefit. If you're receiving Social Security, you have Tricare, and you are employed, you again will start receiving it at 65. You're in the brown box. You check with your employer. If they're going to pay primary, then Tricare will pay second. If the employer is going to pay secondary, then Tricare pays primary. And if Tricare, again, you will want to review the prescription drug benefit, but usually there's no problem not accepting the employer prescription drug coverage, because Tricare has a generous benefit. If you have a health savings account or a federal employer health benefit, or a FEBA, then you will have to look at the turquoise boxes. And if you're in the health savings account, consult your financial planner, your tax accountant, or the IRS to coordinate benefits with Medicare Part A and B. If you are a federal employee, check with the Office of Personnel Management, because there's variation between the benefits that are offered by the different agencies, retirement age, as well as spouse and survivor benefits. Let's take a look for a moment at the Medicare card. It has your name at the top. It has a scrambled number here, which is your Medicare number. It also tells you whether you are in Part A or Part B. If you only want A, you return this card, sign it on the back, and then you will get a new card saying you're only in A. And then when you exercise your special enrollment, you'll get a new card, and it will give you the date you're in A and the date you're in B. This date is important over here, because that's the date you will need to use when signing up for a Medicare Part C, should you decide to do that, or when you decide and exercise your right to enroll in a D. To sign up for Medicare, you will need to open an account at my Social Security account at socialsecurity.gov account. Sign in, create the account, agree to the terms. After Medicare assigns you a Medicare number, then you will want to go to My Medicare at medicare.gov and open up that account to track all of your Medicare benefits. When you are opening up your account at My Social Security, you will need your date and place of birth. You'll need information on your current health insurance. You'll need information on any marriages and divorces. If you have any dependent children, you will need that. If you have had any military service or your spouse has, you'll need the DD-214. If you are either employed or self-employed, you will need employer information as well as information about your tax returns as a self-employed person, and you may or may not need information on your bank account. So now we're ready to move to the different colored boxes, and I hope that you have put yourself in one of those boxes. So if you are in a dark blue box, your next steps are basically for A and B, you do nothing, you already have your Medicare card, it tells you enrolled in A and B, and you're in your initial enrollment period. Part C, you have the option to enroll in a Medicare Advantage plan, or you may want to enroll in a Medicare supplement. If you do want a supplement, it's important to enroll either at your IEP 6 months after the date that you receive Medicare, or at when you get your SEP to protect the benefit for not having any underwriting for any pre-existing conditions. And if you're in the dark blue box, you want to enroll in a Part D using the plan finder at medicare.gov. If you're not receiving Social Security and you're age 65 and you put yourself in the green box, then you will need to go online, visit Social Security office, or call Medicare or call Social Security at 1-800-772-1213, open up a My Social Security account and enroll in A and B. You will also need to send a quarterly check to cover the premiums, or you can have a bank draft. You have the option to enroll in a Medicare Part C or a Medicare supplement, and you will want to enroll in a Part D. If you are in the yellow box and you are employed and your employer offers health insurance coverage and they're going to pay all costs, and you have determined that they have credible coverage, return your Medicare card after you have signed up to Medicare. They will return it, indicating that you have you want to sign it so you can protect your SEP, and you will get a new card then that says you're only enrolled in Part A, do nothing with C and D, because we're going to use your employer's coverage. If you are employed and your employer is going to pay either primary or secondary and they have credible coverage, you're still in the yellow box, then we're again going to enroll online at the Social Security website through the Medicare Part or through My Social Security. We can or cannot enroll in a Medicare Advantage and a Medicare supplement, and we will need to figure out if your employer has credible coverage for Part D. If they do, then we're going to let Medicare or Social Security know that. If they don't, we're going to enroll in a Part D. If you are receiving Social Security at 65 and you have veterans benefits and you're in the bright blue box, then again, you're already enrolled in Medicare Part A and B. You do have to make a decision, and you have two choices. You can continue to receive Part B and pay the premiums, or you can return your Medicare card, decline B, and only use your VA benefits. But should you decide to enroll in Medicare Part B at a point in the future, you will be subject to the 10% per year penalty. You can enroll if you want in a Medicare Advantage plan or a Medicare supplement. Those are optional, or you can continue to just use the VA benefits. You also have two choices on Part D. You can enroll in Part D at the Plan Finder at Medicare.gov, or you can choose not to enroll in Part D, only use the coverage that the VA offers. Some people do enroll in D, mostly because the formulary that is used by the VA sometimes does not have the drugs that they need, and they can get those through D. If you're receiving Social Security at 65, you have VA benefits and you are still employed, and the employer is going to assist you, and you put yourself in the red box. Again, you've signed up for Social Security at mysocialsecurity.gov. You're receiving Part A. You're going to check with the employer to see if they have credible coverage. If they do for Part B, then you're going to return your card and only be enrolled in A. If they don't, well, then you continue to receive B. You again have the option to enroll in Part C, a Medicare Advantage plan or a Medicare supplement. You will look at and ask your employer on the Part D for coverage for prescription drugs, if they have credible coverage. If they do, then you don't have to do anything. If they don't, then you have to decide whether you're only going to use the VA coverage or whether you are going to also enroll in a Part D plan. If you're receiving Social Security and Tricare, you will be in the purple boxes, and you will already be enrolled in Social Security. You'll have you'll have a Social Security account. You're receiving Part A and B. You will need to keep those because Tricare coordinates benefits with Medicare, and their pay after Medicare does. You can sign up for a Part C benefit, but you do not need to. You can also enroll in a Medicare supplement, but that may also not be necessary. Under Part D, Tricare has a very generous prescription drug benefit, and you do have credible coverage. So you do not need to enroll in a D unless you want to. Some people do because sometimes they can get drugs on the Part D plan that they're not able to get on Tricare. If you are receiving Social Security, you have Tricare, and you're employed, you've put yourself in the dark brown box. Again, you're already receiving A and B, and the employer is going to pay all of your costs. Then you want to defer B, sign your card and return your Medicare card and return it. If the employer is going to pay primary or secondary, and A and B pay the balance, you will need to keep it. Medicare Advantage is usually not needed because Tricare functions as a Medicare supplement, but you can enroll if you would like for the additional chronic disease management services as well as the other support services. And as we said earlier, you can make a decision about whether or not you want to just use Part D drug coverage through Tricare or whether you want to sign up for a D. If you have an HSA or you're a federal employee or retiree, you will be in the turquoise boxes. If you're in an HSA, consult your tax accountant, your financial planner, and the IRS for A, B, C, and D coverage so that you can coordinate with the different parts of A, B, C, and D for Medicare and your tax situation. If you are a federal retiree, consult the Office of Personnel Management for your A, B, C, D coverage because of the variation. So the next thing we want to take a look at real quick is enrollment in Part A. Again, if you receive Social Security or retirement benefits, you've already been enrolled. If not, open the Social Security account and apply online, on the phone, or at a local office. You basically cannot defer Medicare Part A. So once you turn 65, you open the Social Security account, or you're already receiving Social Security, and you will get the benefit. Enrollment in Part B. If you are receiving Social Security, you're automatically enrolled. If not, do the same process as previously. Open the My Social Security account, apply online, call the Social Security office, or visit one. If you wish to defer B, indicate that on your online application that you wish to defer it, or you can sign your Medicare Part B, or you sign your Medicare card and return it to Social Security. You can enroll in Medicare Advantage very differently. This is an optional benefit. Nobody has to sign up for Part C. Part C is run by private insurance companies. They are approved and regulated by Medicare, and you sign up either through Medicare.gov or through an agent. An alternative is to sign up with a Medicare supplement through a private company as well. Enrollment in Medicare Part D, you can either enroll online at Medicare.gov using the Plan Finder. You can call then, and that's after you've done your research about the plan that you want. You can enroll directly, you can call an agent, you can call 1-800-Medicare, or you can call us here at the Society and we will help you. You can defer D by indicating that if you do your online application, or if you're doing a phone or in-person interview, or if you return your Medicare card and defer B, then you also defer D. So let's spend a few minutes talking about the special enrollment period and what triggers a special enrollment period or an SEP. One is that you move and your Part C and benefits do not follow you. You also could be admitted or discharged from a nursing home. The second way to trigger an SEP is that if you lost Medicaid, you either retired or you were terminated from your employment, or the Medicare Part C or D company that you were receiving coverage from has left your area. You can also qualify for an SEP if you need help paying for your Medicare Part B through the Medicare Savings Program, or D through the Extra Help or Low Income Savings. If you do not set up your SEP correctly and you defer your IEP to an SEP, you can be responsible for penalties. The Part B penalties are 10% per year for every year you're eligible and you don't apply. This also happens if you don't have credible coverage from your employer or whatever other company you might be involved with, such as the Veterans Benefit or COBRA. Similarly, if you don't do it correctly, you will trigger a Part D penalty. And that is 1% per month for every month you're eligible and don't apply. And you can avoid that if you have credible coverage as well. So to enroll in a Part B with an SEP, if you have lost coverage because of employment, you, the beneficiary, have to complete a CMS 40B and submit that to Social Security. Similarly, your employer has to complete a CMS L564 to verify your employment and enrollment in the group health insurance. You do have 8 months after you leave employment to sign up for Part B without a delay in coverage and without a penalty. Similarly, you use the same process to enroll in Part D if you are exercising your special enrollment period because of employment. When does coverage start? Basically for Part A, it starts the first day of the month that you turn 65. This is your initial enrollment period or your IEP. Part B starts the first day that you turn 65 on your IEP, or the first day of the month of your SEP or your GEP. Part C only starts if you enroll and you then are eligible the first day of the month that you turn 65 on your IEP, or if you are exercising an SEP or a GEP, you would be eligible to enroll, but it is optional. If you do decide to enroll, you could also have an alternative date if you change plans during open enrollment with the start date of January 1. Part D starts the first day of the month that you turn 65 and you enroll in a Part D, or the first day of the month of your SEP or your GEP. And then if you change your prescription drug plan during the annual enrollment period or open enrollment, then your new coverage starts January 1. If you have to exercise a general enrollment period, what triggers a general enrollment period? Basically, you didn't do something correctly with your initial enrollment period or your special enrollment period. Your GEP starts January 1 through March 31. You can enroll in Medicare Part B or D with coverage to start July 1 for B. Coverage for D starts January 1 after you enroll. The penalty if you have to exercise a GEP is the same as we said before, 10% per year for every year you did not receive coverage under B, and 1% per month for every month that you did not receive coverage under D. So where can you go to get help? You can do two things today. You can request a goodie bag by putting your name, address, and telephone number and sending us an email at cogs@senioranswers.org. Do not put that information in the chat, but send us an email. You can also drive by our office to get more resources on Medicare through our Medicare on the Porch program. Pull in the driveway, grab a bag off the porch. You don't have to talk to anybody. You don't have to ask any questions. You can do that on October the 26th, November the 2nd, November the 9th, or the 16th. You can do that at two different locations. One is at our office at 1129 Pennsylvania Street in Denver, or you can go to Holly Creek at 5500 East Peak View in Centennial. We also have a Medicare Toolkit, which includes information on individual counseling. Just about any question that you might have about your Medicare, you could certainly call our office and talk with Pat or one of our other Medicare experts. We also are offering Medicare management counseling with the University of Colorado School of Pharmacy students for drug reviews, counseling on drug plans. The appointments are by Zoom, and we have appointments available on November 4th and 5th from 5 to 6:30. Other things that you can get out of the Medicare Toolkit is you can visit medicare.gov, which is the official site for Medicare. It's where you're going to find the Medicare Plan Finder. We also have available the newspaper that the Colorado Division of Insurance, the Senior Health Insurance Counseling Program, prints every year, which does a review and analysis of the Medicare Part C, Medicare Advantage plans, as well as the Medicare Part D prescription drug plans. And if you would like a copy of that, it's in both the goodie bag as well as the Medicare on the Porch tools. It's also available through the website and a link on your follow-up information from today. Other resources we have in the toolkit is you can visit our sponsors at Humana, Integrity Insurance, Kaiser, or Cigna at the end of this presentation in the expo hall, or you can get in touch with them directly. If you would like a complete list of the Medicare Advantage plans, the Medicare Supplement plans, and the prescription drug plans that are available, visit medicare.gov. We invite you to join us at the expo now. You can visit with all of the booths. Remember to go to the navigation bar up on the left-hand side of your screen. Click on the little tent for expo, and you will be in there. Click then if you want to just chat with somebody, if you want to visit or talk with somebody. So we look forward to having you gain as much information as you can. I will join you in the CGS Expo momentarily. Thank you all for coming today. If you have any questions, feel free to send us an email at cogs@senioranswers.org or give us a call at 303-333-3482. Thank you for attending, and let us know if you have any questions.